Welcome back to Entry Level Mums. I hope you guys have been good. I'm Nasra.
I'm Suya. We're back.
We are back. We are sorry we've been gone for a while. Life again.
Yeah.
Again, we have kids. You guys understand this. But I wanted to just say, because we always forget, please do like, share, subscribe. I always forget to tell you guys this. Please comment on anything that you have questions on, anything you want to see from us. Whatever it is that you guys have on your mind, send us a message. We love your messages. We love hearing from you guys. We enjoy hearing from you guys. You probably will be speaking to Suya on Instagram because I'm terrible with socials. Mm-hmm. But yeah, please do send us messages. We love it. Yeah. Suya, I'm going to let you introduce our wonderful guest today.
Yeah. Today, guys, we have a special guest.
Mm-hmm.
This is someone we've always wanted to speak to. We finally have a doula in the building, guys. I'd like to introduce you guys to the lovely Karina.
Yes, hello.
Hi, Karina. Tell us about yourself and what you do.
I am a doula. So I run a business called the Kente and Karing Doulas. I've been a maternity nurse. So before being a doula, I was a maternity nurse. Still am. And also a healthcare assistant to people who are vulnerable, like people who have diabetes, end of life. So I'm in the care profession.
Wow.
Yeah. Oh my God. A maternity. Can we talk about the maternity first?
Yes.
So what kind of inspired you to become a doula? Like, did you see anything that you thought to yourself, nah, these women need better services, or maybe they need something that's more one-on-one instead of relying on the NHS?
Yes.
Like, what inspired you to become a doula?
I think what happened is the first birth I attended I was actually 15. It was of my best friend having a son.
Wow.
So I've always been there as a supportive person.
Yeah.
And it's funny, I done my work experience in maternity.
Oh, wow.
But then I went to a whole different field, like to admin and business.
Yeah.
And then somehow I came back into the NHS. And so I've been a maternity nurse for over 15 years. What inspired me to be a doula is what I've observed within the maternity health service. So the thing is, they're very understaffed, and you don't always get the continuity of care, especially if you're just having a hospital birth. Maybe if you're having a home birth, you'll have the birth team with you, and you'll have a team that will give you continuity of care, but you may not always see the same midwife. And I think my dad mentioned it to me a few years ago about becoming a doula. He was telling me that Erykah Badu became a doula, and he was telling me I should go into that field, but I kind of just put it on the back burner. And then as I've been observing more and more and seeing the support that I offer to women naturally, I felt, no, this is the time. Because what happens a lot is when I've worked in the antenatal department and women go into labour. So we had one lady, her labour was progressing quite slow. And then I think she had her pessaries and it progressed quite fast. And then I think we heard noises. I was on a night shift. Me and the midwife heard noises because the staff room is not far from the bathroom. And we heard noises. We was like, no, that doesn't sound good. Went into the toilet. The husband and the wife were there. And as soon as we looked, the husband nearly collapsed because all the waters have gone. The baby's head was there.
No.
So we had to deliver the baby. I had to assist the midwife in delivering the baby in the toilet. So this is the thing about understanding how your body naturally works. And I feel a lot of the time you're not always listened to.
Yeah.
And I think that can be because I think that's what can make your labour experience traumatic, that you may not feel listened to. Not actually the birth.
Yeah.
It may be that you're saying you can feel something coming, because I've witnessed this a number of times where the ladies felt it coming, but she may be acting erratic, so that gets more attention than her voice and her opinion. And then I think one time we brought the lady to the corridor. By the time before we can get her into theatre, that baby's come.
Oh my gosh.
So it's about, I think that's the reason why I think also you should have a doula, because that if you employ that person at the beginning of your pregnancy. They're there to support you.
And
if you have any
advocate.
questions on the phone, and advocate for you and help you with a birth plan, support you when you're feeling overwhelmed. And I think you get that one-to-one care with somebody. The doula can be present in your birth.
Yeah.
When you're going into labour and after you have the baby. So it's just your support system.
You know, when you're having your first child,
Yes,
and you're like, oh, I feel like something's happening, and they're like, it's just your first kid, you really don't know what you're talking about.
Honestly, that's what they do.
And then I feel like when you're on your second kid, they're like, oh, you've done this before. And then they're like, oh, well, just because you've done this before, you know, why are you screaming so much? You've done this before. You know what this is like. And it's like every birth and every experience and every child is different. And I feel like they don't give women as much grace as they should.
I agree.
So I totally agree with having a doula. And I wanted one present when I was giving birth because there was literally nobody there to advocate for me. And my poor mum was like, oh my God, my child is suffering. And that's all she could think about. In her head is like, how do I help her? I can't help her. But if she knew the tools to actually help me and advocate for me, then it would be a lot different. My daughter's dad, he was just there like, oh my God, like this is a lot. And then his mum was just in the corner, like doing nothing. Yeah. So it was like a whole bunch of people in there that were absolutely useless. And if I had someone who actually knew what they were talking about, who could listen to me, who could advocate for me, who could tell the woman she said no, you know, there'd be no stress, there would be no pressure. Because I felt so much pressure from like the epidural to like that injection that lady gave me without my consent, to like all of like just the experience of not being listened to was probably the most traumatic thing. And everyone needs a doula, but like not everyone can afford a doula, right? So how do you deal with people who are, you know, who would like help but cannot necessarily afford it?
I have a special package, like a community care package.
A bit closer to the mic.
A community care package on my website. So for someone who may be struggling financially, depending on their circumstances, I can maybe offer my care to them, depending on how many clients I have, because I wouldn't want to commit to somebody and I can't give them the full care.
Yes.
I also volunteered for a company called Doulas Without Borders. So they have a lot of vulnerable people that may be on their books. So I actually helped a lady from there who had twins. I'm still actually helping her. So that was like just volunteering.
Pro bono?
Yes.
Oh, that's beautiful.
Just to support. So I think you have to have a balance of everything, because you're giving away your time and your services. Somebody can be like, I've had a call from someone 12 at night who needs my help, who felt unsafe and didn't feel the midwife was listening to her, and I drove to support her and help her. And it's funny enough, when I went to go and meet her, she had a friend present, and the friend had suffered a loss at 24 weeks.
Oh, no.
And she expressed to me that she was like, where was you when I was pregnant? I would have loved to have had someone like you advocate for me and support me. And that felt very warming, because she said that she likes the way how I dealt with her friend, because I'm a firm believer in being firm but nurturing. Because I don't want to give you fairy tales and that's not the exact experience you're going to get, because you're going to have an expectation and be really disappointed in the service I give you. So you have to be very honest.
Yeah.
And I feel a lot of the time, because the women are in a very vulnerable state, I feel you just need to be very direct with the person about their wants and needs. Like, if somebody's making a decision that may impact on their baby or their health, I would advise them correctly. But also, as a doula, you don't advise someone from a medical side, even though I'm trained as a maternity nurse, you wouldn't. So like, if a midwife became a doula, if you're hired as a doula, you're there to support the person, not to give them your medical training.
Yes.
That's the difference.
Okay.
You couldn't get involved if it's medically necessary. I would only maybe advise somebody. So if I had a patient and they were being advised by the doctor and the midwife, because the doctor gives different advice from the midwife.
Okay.
Because remember, the doctors are more, they would do the cesareans. Remember, midwives are not involved in that part.
Yeah.
So they have different roles. So sometimes a lady may feel pressure from those two people. So it's just about me, from my experience, to reassure them that they're telling you this because these are the protocols, and they have to tell you the negatives and the positives, and then you make an informed decision. So I will just reiterate what the doctor and the nurse is saying. Yeah, just to support the lady.
Oh my God.
You know, I feel like sometimes they make you feel as if you don't listen to them, that something will happen to you or your baby. And after carrying your kid for 9 months, there's no way in hell you want anything to happen to you or your baby. So I feel like sometimes it's unnecessary pressure, even though from their standpoint, it's like, we're just giving you the information. But from your standpoint, in that vulnerable state, it's like, I'm being pressured.
Yeah.
So I do feel like people really do need somebody there.
Definitely.
Do you do like courses for like, for example, if you couldn't be somebody's doula, could you potentially do like classes for like partners and birth partners, for them to be able to advocate for their partners in that moment if there's no one else there?
That's something, yes, I would like to do. Definitely.
Yeah.
Because even down to when you're pregnant, a lot of the times, if you don't feel supported, or you're not listened to, or you have the birth trauma experience, a lot of the times you can have baby blues, which it lasts for a short space of time, but you can go into postnatal depression also.
Yeah.
So for me, I would like to create more awareness of those things, and to make the partners aware of how they can support, because I see a lot of partners in the hospital, they kind of don't know what to do.
Yeah.
They don't know what to do. So sometimes I've had to be there, like telling the husband, come off the phone, like help her to breathe, like I'm holding her hand. The husband should be taking that lead. But that's why I feel a doula is important, because the lady may bond well with another female.
It's true.
In that sense, because the female woman may understand more of what she's going through. The husband sometimes can feel a bit helpless, like, because you're feeling a pain he doesn't understand.
Yeah.
So it's kind of hard for him.
Yeah.
Like,
but it's also like, you put me here, so why are you not doing your absolute best?
I get that.
You are the reason why I'm in this pain. So why are you not rubbing my back? You know?
No,
But
I've
remember,
seen
years ago, men were not present.
That's true.
During when women had their babies, they waited outside.
Yeah.
And some men may want to be inside, but that wasn't the way things were.
That's true.
So maybe also the men feel vulnerable because we don't ask the men how they feel.
Yeah, it's true.
Because even the same thing as postnatal depression, men can suffer with that also.
Oh, can they?
Yes.
Yeah.
I
Dads can
didn't
get it
even
too.
know that.
Yes. And I
Yeah.
think men and husbands, partners are getting left out a bit when it's two of you. It's 50-50.
Oh, they can get that too?
They just express it differently, because remember, men are told to express things differently from women.
Yes.
So, and that's why you have a lot of mental health crisis, because I think it's listening to people, and even if you don't agree with it, let the person voice how they feel, and don't disregard it.
Fair.
Yeah, I think it's also that financial stress that's put on men as well.
Yes.
Obviously, babies are not...
Oh, they're not cheap.
They're not cheap.
They're not.
They're expensive. So I feel like after they become a dad, they have this new level of like, I have to work harder. I have to put more money on the table. My wife's not working for a long time. I have to support the family. I have to make sure I buy everything for this child.
Yes.
So I feel like that also adds to the depression that they may.
Definitely. It's the pressure of providing.
Mm-hmm.
And then you got to also think, in the society that we live in, it's a lot of pressure, because to me, I think more women should probably stay at home for a bit longer, to look after their children. Obviously, that could create more of a strain on the husband, but I think that should be spoken about beforehand, because you got to remember that when the woman does go back out to work, you have to pay for childcare fees.
Oh my God.
So you have to work out. It's like you need to do a pre-plan before you have a baby, and work out, how are we going to work this out? What are the costs? Is it better if I stay at home for a number of years, or I go to work? Because if you go to work, what you're earning, you're going to be paying it out to a childminder.
Yeah,
Trust me.
you will.
Trust me.
And I feel like when you're working and your babies are under the age of 2, you're basically just working to pay that money.
Yes.
So whatever money you're going to make, it's childcare is so expensive.
Oh my God.
Childcare here is like $1,500 a month. And if you make $1,500, that's one of your paychecks going straight to. So what's the point of you being at work?
And that's
Work is like, I think it's for your mental health. I get that. but then do part-time, because
I agree with you completely.
do you know what I mean? It's more for your mental health. Because when I started working again after my kid was when she turned 3,
Yes.
I'm crazy
Yes.
improvement on my mental health. Crazy.
Yeah, I know.
Like, it was a huge jump. Like, you remember, you seen like how big of a jump it was. I went from being like depressed to being like, okay, well, I feel like I have a purpose now, you know? Even though I had a purpose before, but like, yes, my daughter is my purpose, but like, it's a 24/7 purpose, so I need a break from that purpose.
I think the main thing is, for me, like the patients that I've come across and the clients that I'm helping, the main thing I think when women become mothers, it's keeping your own identity as well as being a partner, a wife, and being a mother. And I think that's why going to work can feel like respite, but it should be part-time, because if you're in the house, it's constant mum.
Yep.
And your work is like your getaway. So I think you just need to find other things, like maybe going to the gym, going for a walk, and other things just to help with your mental health. Not that work is just your outlet.
COVID really ruined a lot of things for people, honestly, because that's how I ended up in the hole I was in.
Okay.
COVID really, like, it messed things up.
Yeah.
You want to go outside, but you feel like you're afraid because you might get sick, and then you might make your baby sick, and your baby's still a baby. So you don't want to harm your baby in any way, but you also want to be outside. And if your partner's at work and it's just you and the baby, there's really no opportunities.
Hard,
it was so, and you want to go get a coffee, you can't go get a coffee, you can't go for a dessert because everywhere's closed. You can't do so many things that you would have done normally that would have helped with not being in that like deep of part of the hole.
Definitely.
Honestly, COVID ruined a lot of people's lives, and I feel sad kind of for COVID babies, because they're different as well. And I was speaking to a teacher the other day, and she was saying that the challenges that they face with the COVID babies are so like unlike anything they've ever seen before. Like, the COVID babies are different. They cannot share. They don't like being around other people. They all sort of play by themselves. Like, they're socially awkward. The social skills are non-existent almost. Like, they're just different.
I agree with you, because when we was dropping our daughter to nursery, I saw how some of the children were behaving. It was like attachment issues. Because you've been in the house for so long, whereas I worked in the hospital, so I was still going to work. So my daughter was in childcare, but I was lucky because childcare was my aunt, who's a childminder.
Nice.
So she was with family, so she didn't have as hard of a transition once she went into nursery. Whereas I saw a lot of other children like screaming. I saw one child vomit. So it was a lot. I think what would have been handy, thinking back now, what would have been good for the mothers, I don't know what could have been done for the baby, but for the mothers, what could have happened is like a virtual, like Zoom kind of call to speak to other people. I think that might have been healthy for people, for their mental health, even though you couldn't go outside.
COVID was really sad.
I want to talk more about you as a mum as well. I know you're a mum. How were your birthing experiences? Because you've got 3 girls.
3 girls, yes.
Did you give birth all naturally, or did you have like complications?
So they were all different. Our first daughter, she came just before her due date. I remember having labour pains. They kicked in quite quickly. I was able to manage. My mum thought I was going to go into labour like very quickly, so she called the ambulance. We went to the hospital. As soon as we arrived in the reception, the midwife came. She wasn't that friendly, and I think the ambulance man thought I was going to give birth in the ambulance. So I think if he had time, he would have addressed that lady about her tone and her behaviour. But obviously he's an ambulance driver. He doesn't have time for that. And she was very funny, but because I was going through contractions every like 2 to 3 minutes, I didn't have time to pay attention to her.
Exactly, yeah.
So she examined me, and when she examined me, she was quite shocked that I was 5 centimetres dilated, that I was able to manage my pain quite well for my first child.
My goodness.
And I also think that she thought I was younger than what I was, and I think she thought my mum was my sister.
Oh, wow.
So I don't...
Assumptions.
I'm used to... I'm so used to it. And what happened is I said I want a water birth, so they got the water ready and everything, and within half an hour I'd given birth.
Wow.
I went home the same day.
What?
So I had her probably like 5, 6 in the morning, and I was home by 12.
Water birth. Oh,
I
my
went home by
God.
12 o'clock.
Low risk pregnancy?
Low risk.
Amazing.
And I think, yeah, and I went home and everything. And then the second time, oh, that's another thing. She made me walk from the reception to the home from home room. I will never forget this. I remember when I went back to work in the hospital, and I thought, let me do this walk that this lady made me walk.
Yeah.
And I done the walk myself. I said, oh, this woman put me through torture, but my contractions were kicking in every 2 to 3 minutes. I didn't have time to respond.
Yeah.
And then my second daughter, I decided to have a home birth.
Wow.
That went well.
Amazing.
Same kind of thing happened. I had the pool set up in my mum's living room, and the midwives, because you have like the home birth team coming round, they came round, examined me. I was 5 centimeters dilated. Then when I was in the water, because you can only go in the water when you're 5 centimeters dilated, because the water, because you're relaxed, it can slow down your contractions.
Oh, okay.
Yeah, so you need to be kind of nearly
Active
to active labor.
Yeah.
Okay.
And then it kind of, I was so relaxed, it slowed down my contractions. So everybody thought, no babies come in. So she was like, the midwife was like, you need to come out the water and you need to go to the toilet, move about.
Yeah.
I was not in the mood. I didn't want to get out. I was so relaxed and in my own zone. I did not want to move, but I thought, oh my gosh, I've got to get out. Went toilet, nothing happened. Then I went to lay on the sofa. They all thought no babies come in.
Oh.
And I think the midwives had used a lot of the tissue paper. So my mum, she thought, oh, let me go shop. The baby's not coming.
Yeah.
Don't tell me
Then
she
I
missed
went
it.
on the sofa.
No.
And I was like, no, I can feel something. I can feel something. By the time my mum's come back from the shop, which is not even 5 minutes away, my second daughter's born.
You're joking.
Wow.
Second daughter's born.
Wow.
So that was quite quick.
Wow.
That pregnancy, I suffered with postnatal depression. That pregnancy. Third daughter was born at the hospital. I wanted a water birth. But the midwife wasn't able to do it. She had back pains. Same thing happened again. I went into labour. I drove myself to the hospital.
Oh my God.
She went overdue.
Karina.
Wait, you drove yourself to the hospital?
So what happened is she went overdue, and I prayed, I done yoga, I danced, I done the Michael Jackson on the Wii, anything to get this baby out, because I was past it. I was like, no, because my daughter was due just at the end of August.
Yeah.
And as you know, with the school year, if she goes the 1st of September,
Yeah, she's another year.
So she
yeah.
decided to add an extra year of childcare.
Oh, my
wow.
God.
So she came a few days after in September. So then what happened is I was walking around where my mum lives, like just say like around a block. A walk that should have taken 15 minutes took me 2 hours, but it helped my contractions come on. So I got my contractions like to kick in.
Wow.
My daughter and my mum came to the hospital with me. I had a contraction as we got to the car, dealt with that, got in the car, got to traffic lights, had another contraction, went through that, got to the hospital.
Wow.
Had another contraction as I've got there, got through that, and then walked upstairs.
God was with you.
Allah is always with me.
Wait, you were
was
driving?
with you.
Yeah, I
I'm
drove.
still, no, I'm still
Contraction
spinning.
mid-driving. That's nuts.
Because
And
I
the
would have
same
stopped
thing
and called the ambulance.
No, I don't know. I just sailed through it. I was fine.
Wow.
And same thing, I was like halfway through. And then when I think they thought nothing was happening, the woman was just about had time to put on her gloves, because my waters don't go early. My waters go when I'm
Yeah.
Oh, wow.
just before I'm about to go into labour. And then I gave it was so I give birth within 2.5 to 3.5 hours.
Wow.
So it's very quick. It's very quick.
I also feel like your
Allahu
pain tolerance
Mubarak.
is really good as well, mashallah.
Yeah, but also with that, and that could be a problem within the health setting, is that you manage the pain so well that
they don't take you seriously.
they don't take you seriously.
No.
And I think that, because it's funny, because when I tell people I'm a doula, the amount of people that debrief their pregnancy experience to me, like their birth, is crazy. So I was like, maybe I need to do like a group where people debrief their pregnancy, because you don't always get to talk about it. Like, how did the birth go for you? Because sometimes you're holding on to that trauma or that experience, and I feel sometimes you just need to get it off your chest.
You know, I did that the other day.
See?
I had an actual meeting with a lady from the hospital. Remember I was telling you about it? I actually had the meeting, the debrief, and I sat there and I went through my whole pregnancy, my whole birth.
It's important.
And why everything happened, and I expressed myself and how it affected me after.
Yes.
And the fact that it was the catalyst, the trigger for all of the other horrible things that happened to me after.
Yep.
And I cried my eyes out while I had that conversation with her, and they were really gentle and really sweet and really
good.
really, really caring about my feelings. And big shout outs to Natalie. She was really, really good from that particular trust. She was honestly so gentle with my feelings and so reassuring that it was not my fault.
Exactly.
And that it should not have happened, and that they're gonna work on the cultural aspect of the maternity so that this does not happen to future women of color. And it was honestly, I don't think I've ever gone in depth like that as I did with them.
It needed to happen.
I went so in depth with that conversation that it was really like, I was then remembering things that I had trauma deleted. And they were coming back to me and I'm like, oh, wait a minute. And then that happened and wait a minute. And it was a really crazy like ADHD type of conversation. Yeah. But it was, wow. Some things that I genuinely deleted in my brain because I couldn't face that trauma. It all came back and I just cried and cried and cried. But by the end of it, I really felt like I let some of the stuff go.
It's
like
important.
It was so important for me. I
Very
needed to do that.
important.
And I feel like a lot of women need to do that. Like,
yes. And
seriously.
I agree with you. From speaking to a lot of women and being in that environment, I do feel a lot of women need to do that because they can avoid the postnatal depression, a lot by speaking about their experience. Because, like what you said, when you had that meeting, everything came up, things that you didn't even think of because you suppressed it. When you suppress something, it's still there. Yeah. And it just comes out in different ways. So it needs to be dealt with in order for you to let go. It's just like sweeping dust under a rug. The dirt is still there. The dust is still there. When I lift up the rug, all the dust is going to be there. Then one day you're going to have to face it.
Big facts.
So it's better to deal with it and so you can move forward from it.
There's even a book. What is the title of it? My friend recommended it to me. I think it's called The Body Remembers or something like that.
Yes.
The body keeps score.
Yes.
The body keeps score.
I've heard of that.
Yeah.
I've heard of it.
And apparently, whenever you go through traumatic incidents or things that are like that affect you mentally, your body stores that pain.
Very true.
And when I started doing meditation, I started actually like taking time to be present in this moment now and mindful, and I started doing a lot of wellness things. I just found myself crying for no reason. I found myself like feeling pain in places that I couldn't explain. And the lady that I did it with, she's incredible. Hopefully one day we get her on here. She has an insane story. But her name's Amenti. Doing it with her, she would literally...
Amenti,
the awakener.
That is my sister.
What? I'm joking.
I'm going on a healing retreat with her in 2 weeks. That is my sister.
No way.
She's helped me so much. When you said that name, I thought that name is
There's
not
only
common.
one Amenti.
There's only one Amenti. Oh my
Amenti.
goodness, she got me so happy when she sees this.
No.
Like, she has helped me.
Oh my, me too.
Lot.
Let me not cry. Oh my God, she has helped me.
Listen, I've been through some stuff and she has, and that's the thing as well. That's why I'm saying we need to deal with this baggage as women because we're birth givers. And in order to be within our natural state, in our feminine, we need to deal with these things. So we're not hostile, angry and things like this. And that's something Amenti also helps with. That's what she's helped me.
She's helped me with that
because
too.
otherwise you're just holding on to all that trauma, and it's just a waste. You just need to let go of it.
Oh my God, that's so.
There's
only one Amenti.
There's only one Amenti.
There's only one Amenti.
The goddess.
What?
She's incredible. She is. When I tell you,
me.
absolutely incredible. Like beyond. I took Hannah to it, Big Hannah, and we literally sat there and we did meditation for 1 hour, and we both sobbed. Yes. When I tell you, we both sobbed. Like
it's mad.
Because Amenti's in her purpose. Amenti's in her. She is in her purpose, helping us women.
Her story is incredible.
And that's why I'm doing what I'm doing, because this is my purpose. This is this is like a passion for me. It's natural for me, so I don't have to think about it. So I'm very blessed to be in this role, and if someone chooses me to support them throughout their difficult times, I feel honoured.
So is it when you do get a new like client?
Yes.
Is it like, how do you, because birth is unpredictable,
Yes.
right? So let's say a woman's in her 3rd trimester and she
Yes.
books in with you.
Yes.
She tells you her due date, but like, what if the baby comes weeks before, or like, and like, do you know what I mean? Like, how is it guaranteed that you're going to be there on time? Because what if she has like a quick labour, and then what happens?
So there's no guarantee. So if it's a quick labour, you can't guarantee. Like on my welcome pack, I will give people guidelines when to call me as soon as you feel something, because depending on their distance from me and where the hospital is,
exactly,
I need time, and depending on the time of day, I need time to be able to go there.
Yeah.
So that's it. That you can't promise what you can't give.
Yeah.
So you would just say to the person to follow these guidelines. If you're going through anything or you need support, you just call me on my phone. If it's a certain time, I'll get back to you the next day. If it's urgent, you just call me. I'm quite flexible.
So if you get a call 3 a.m, you like, your phone has to be on loud, basically. You're on call all the time.
I wouldn't say that.
Because
I wouldn't say that. I say I'm quite flexible. If it's meant to be, it will flow and it will work.
Yeah.
And if I'm meant to be present, I will be present.
You will be present.
That's the way how I see it, because you can't give promises that you can't keep up with. Yeah.
I wanted to ask you about the C-section part of what you do. Can you talk us through that?
Yeah, so if someone was to hire my services and they was having a C-section, obviously we'd have a plan. So I would work through a birth plan with them, and the recovery process is quite a long time. A patient I currently have now, she's had twins and she had a cesarean section. So it's about taking your time, especially if you don't have a tribe. So that means your support system.
Yeah.
You need to, if you can, that's why having a doula, or if you can afford the services, sometimes people hire a maternity nurse. Some people have one round the clock.
Wow.
Some people have them like for the whole week after the baby. So they're there 24 hours because some people have the spare room.
They got money.
Yes. Or they may have put it aside before they had the child.
That's true.
Because I feel if people don't have that support system, I feel that is very necessary, especially if you don't have family and support.
Yeah.
If you have family, because you can have family, but they don't support you. Everyone's busy working. So you need to make sure you have that lined up like a plan. So for me, I would support the woman with making sure like meals are prepared. Depending what service she wanted from me, I would work out a plan with her. So it might be meal prep while she gets in the bath, you're watching a baby, things like that, because she'll have to take it easy because of the wound. So in the hospital, what they normally do is, because you normally have a catheter, within a few hours, we would see if you're able to mobilize first, because obviously if you remove the catheter, we need to make sure that you can get to the toilet in time by yourself. And remember, once you're at home, you don't have the medication you have once you're in the hospital. So you need to make sure that you can manage. But I think a lot of women are pushed to rush into things, because imagine you've got other children, you still need to do the school run. So you need to have a plan. If you have a husband, partner, or your friends, you need to kind of have a plan, like if anybody can chip in to take the kids to school for those first 2 weeks. I think that's very important, because you really need to take it easy. You've had surgery, like layers of your stomach has been opened up. I've been in the theatre and watched it, and I remember the first time I watched it, I thought I was, because I've never had a cesarean section, so, but I still have empathy for women that I look after. I always tell them, take it easy on yourself, because you can feel the rush of emotions of them. And I always talk about postnatal depression because it is so common. It can't always be avoided, but at least if you see the signs coming, you can. So that's why I would make sure I provide a plan for the lady, just to help support her to make things easier. If you have guests, what do you want your guests' rules to follow? Do you want your guests not to touch your baby, not to kiss them, make sure they wash their hands? I will tell people, if you have guests, tell them to bring food.
That's what Somalis do.
That's actually what we do.
I'm mixed of Sierra Leone and Jamaican, so I feel those traditions are very important to bring back into place. 100%. Like I always mention, your tribe.
Yeah.
Rope in your tribe as much as you can. It will make things easier for you and take the pressure off of you, because that's why you should have a tribe. Same thing in a
100%.
relationship. It's not just you two in a relationship. It's the mum, dad, your friends, blah, blah. Not that they're sharing your business, but in order for you to keep
a network of
a
support.
network of people. It's just like raising your children. It just shouldn't rely on the mother and father. You've got the grandma, the aunties and stuff to step in, because we all bring a different dynamic of a relationship. 100%. It's important.
You know, I think we should talk more about saving for stuff like this. I feel like we save for rainy days, we save for cars, we save for houses. Why does nobody ever think to put money aside
For a doula.
for after they give birth? Why don't we ever think that? Like, why is that not something that we do?
It's funny because I think a lot of people are not aware of what a doula is.
Yeah.
And I think a lot of people in our community think that's not accessible, that it's just for a certain type of people, but it's for everybody.
Yeah.
And it's true what you said. You should put away that money for that support, because it would help you out, especially if you don't have your partner around. Your partner could be on holiday. Your mum might be old and she can't help. People may live far. So it's really important to get that support. And also I think it's on Doula UK, if you're struggling financially, you can still maybe get a doula. You got to apply for the funding.
A subsidised one.
Yes.
That's
so you
really
can
good.
still have access to that if you don't have the funds. But like what you said, people are quick to buy bags, shoes. How about you invest in support for your mental health and well-being after you have a baby?
That
your
is
recovery.
You know, in America,
100%.
I think it was in America. Remember I showed you that video of it was like a retreat that women go to after they give birth.
Is it the birth centre?
Yeah, it was sort of like a birth
in Virginia.
centre. I think so, yeah.
The lady that opened the first birth centre.
The Asian lady that was there,
I
and she paid for it.
Yes.
And they would like Michelin star, like chef cooked
man, it looks
meals,
so good.
like and healthy and nutritional meals. She can sleep whenever she wants. Somebody will be there to look after her baby. They'll do night feeds. Like they'll do like yoga. They'll do like the mums that are there all go on walks together and stuff like that. Like for the first, I think it was 2 weeks after they give birth. And I thought that was the most incredible thing that I've ever heard.
Retreat.
It was like a spa sort of thing, yeah.
Because
I saw it on TikTok.
Yeah.
That feels refreshing to me, because I would like to create a service like that, because I think even in
I would too.
I think in China, the government pay for the nannies to come and do those kind of things.
Wow.
They cook for you, look after the baby, things like that, just so you can rest. Not that it's taken away time from your bonding with your baby, but it's just to support you through that transition.
I'm telling you, it's the lack of sleep.
Oh, sleep deprivation.
Listen,
and that happens in pregnancy.
That was genuinely, I feel like that was the number one factor of why I was so depressed.
Yeah.
It was the lack of sleep.
And when you have a newborn, depending on whether you're breastfeeding or bottle feeding, you can have a routine to a certain degree because your baby's newborn. I think a good thing to kind of bring in is when you're doing things around the house and say you're by yourself, a good thing to have is a sling or a lapper, we call it, like in Africa, where you wrap the baby around your back or the front, and it can help you and it will soothe the baby also. I just think it's about finding tips that work for you and that will just help make things a bit easier, because the baby will naturally sleep, because the baby can hear your heartbeat. You're soothing. When they're far away, you think being so small and being far away from something, how you may respond, and that's how babies respond. So if you have them close to you, you can still do things.
I didn't do that the first time. I
did.
I actually bought a carrier, never opened it.
I did.
No,
I had her.
It's...
She was on me 24/7.
Yeah.
I had her on my chest as I was washing dishes, and it was awkward. I was doing this. It was weird, and I was washing dishes from afar. I had to get the long scrubber thing. I had to get that because it was weird.
Yes.
But she was consistently on my chest. Like we didn't leave each other. In the newborn phase, I barely left her side. Like she was with me the whole time, and when she was sleeping next to me, I would play the womb sounds and the heartbeat sounds, and it would calm her down instantly. She'd be screaming. She'd hear do. She'd be like,
yeah, and that's why I think it's about finding things that work for you, because what may work for others may not work for you.
True.
And don't compare yourself to other people, because that's what people like to do. My baby done this. My baby slept through the night. Your baby's a week old. They shouldn't be sleeping through the night because they miss feeds. So that's not. I've heard that so much times on the ward, and I'm like, that's not a good thing. Literally. Or the baby's sleeping and they're wide awake. I'm like, no, you need to go sleep. I would always say to women, like, when the baby sleeps, if you don't go doing too much around the house, like, as I said, get your tribe to come in and help you with little bits and pieces.
Yeah, 100%.
But rest, you have to have cat naps.
Yeah, 100%.
If the baby sleeps for an hour, you sleep for an hour.
I'm telling you, that's what I did.
Get the sleep where you can until the routine changes. And obviously, as they get older, the food changes, they go on solids, they'll start to sleep a bit more. I think it's just about having a routine and finding something that works for you and your baby.
I agree. Also, the housework is not going to go anywhere.
No.
It's always going to be there.
Laundry.
If you do the laundry right now, in 5 minutes, you're going to have more laundry to do. With a newborn, you're doing like 5-6 cycles a day. So
the spit ups, and that smell.
And then when they shit themselves and it goes all the way up their back.
Yeah. So I gave somebody a tip the other day of that. So you know when you get the yellow greeny stains on the things, and you think, oh, you've got to throw them away. Yeah. No. You need to make a solution of washing up liquid, baking soda and vinegar, like a paste. Have that put to one side. Whenever that happens, you leave it on the stain for like 5-10 minutes. You can hand wash it out and then put it in the wash. The stain will come out.
Do you know how many times I've thrown out her clothes?
Do you know how many I've thrown out?
And it's crazy. We throw it out because it looks dirty, but it's clean.
Yeah.
Yeah.
Because imagine people come over, they're going to think your kid's all like dirty and disgusting, but really you've washed it 20 times and it's still yellow.
You've washed it. Try that solution. It will work.
Okay.
Yeah.
That's very nice. Do you have any other tips?
Yes.
But you know, when you come to a bath, I've always been curious. What do you bring with you?
What do I bring with me?
Do you bring any specific, like,
I know
things?
They say like a doula bag. Some people bring like, they're like little snacks just for them, or for the patient they may bring like an oil to like massage the lady, like just to relieve her. Also, there's a comb that's supposed to help take away the stress. I'm gonna purchase one of those. I'm just gonna have my bag full of like little bits and pieces, like a stress ball, different things, because different things work for people differently. I would always have a speaker, just in case a lady wants to play some relaxing music.
I wish I had Quran playing in mine. I wish. I think I'd be so much more relaxed if I had Quran playing. And as well, if you do have women that come in who want to play Quran, play An-Nisa. Al-Nisa is the surah of the women. Yes. And apparently it really helps. And Surah Al-Maryam as well. Apparently they really help. I've heard so many ladies who said that they played these surahs on repeat and it completely changed the way that they were giving birth and their attitude to it. Yeah, they said that even the contractions felt different. They said even the pain in their body subsided a little bit.
Because your body responds to what you're hearing. So it's like hearing the waves of frequency. Yeah. Your body responds to it. So sometimes I think you need that just to drown out. Yeah. Even if like someone bought like headphones so they can drown out from what's going on in the room. Because sometimes if a woman does have complications, you can have a lot of people in the room. You might have the doctors, the nurses and the midwives, depending on how things are going, and sometimes that can feel very overwhelming.
Yeah, it does.
And that's why it's good that if you do have a doula going for a birth plan, you don't want, say if people are coming in a room, they're only in the room if it's necessary.
Yes.
You don't want extra people. Some people might not want a student midwife. So it's about having those boundaries respected.
Yeah.
So your doula is your advocate. Your doula is your support person who's going to listen to you no matter what. And I feel that's really important to have. Someone that's advocating for you, going through a very vulnerable state.
Not only just that, somebody who looks like you.
I've had this a lot. Where people have reached out to me based on that, seeing someone who looks like them. Yeah. And I think that is, it seems to be quite a big issue, because in the hospital, the deaths are higher with people of colour. And that's miscarriages, that's stillborns, and that's women dying throughout pregnancy. And it's like, why are the numbers higher with people of colour? That's because you're not being listened to, because they feel that you can handle your pain. And it's also about you following your intuition. Like I saw a video the other day where a lady was having contractions, but I think the midwife wasn't like taking it seriously, so the midwife left, and the woman was like, no, I can feel something. She gave birth because she said, always trust your instincts, because I can't tell you your instincts. If you tell me your foot hurts, I can't tell you it doesn't.
No, you can't.
Do you understand what I mean? So I think I just think we just need to be treated like human beings. That's my thing, because I done a course, I think a few weeks ago, called Supporting Muslim Families. Even though I'm Muslim, I still thought it's good, because remember, we still have different cultures.
Yeah.
And 3 of us were Muslim on there, and the other people, when they heard our stories of what we've experienced, they was in complete shock, about our experiences. And this happens on a day-to-day basis. Like if you're upset with the care somebody gives you, you've got to be able to communicate that and articulate that in a correct manner, where you're not going to be accused of being aggressive.
100%.
So these are things that we walk into even when we're parents at schools, because this is how I have got to adapt myself and transition myself, because I don't want to be accused of being rude because I'm triggered, or you was rude to me, and you want a solution to the problem. So you don't want to add fuel to fire. You want to get to a resolution. So I think it's really important. That's why I said to have someone that advocates for you. And the thing is, when I take on a client, I will do a consultation to find out their needs, of what they want from me, and what I can provide. And it's crazy how a lot of people say it's because I look like them. And even people who don't look like me still would like my services because of the emotional care and the support that I provide.
What kind of techniques, like when she's in that transitioning period, what kind of techniques do you use to help her with the pain?
Depending where she's at with her pregnancy, progressing with like the labour, I would hold her hand if she needs to hold my hand. I'd say, even though I'm little, you can squeeze my hand. I won't take offense, because I've had this before where it's happened. And I just tell them to breathe, because screaming is not going to help you. So I just tell them to relax and try and breathe and slow things down, because it's like you're pushing your body into a panic. That's one of the main, I think, techniques that I use. And I feel that's helped a lot of women, and to reassure them that they're doing well, because during that period they can get very overwhelmed, but you can only do what you can do. You can't force the baby out. The baby's going to come when it's ready. And then it's just for the woman to relax, because sometimes it's because you can't take their pain away. If they're feeling a lot of pain, all I can do is refer that to the midwife and say, this lady's in a lot of pain, she's struggling. If she's not having gas and air, I'll maybe say to her, would you like gas and air, because that can help you. Some women, they may vomit and have a response to it. So I would just say, try that, and try like relaxing techniques. Some people do hypnobirthing, that can help them. And it's crazy, I've come across the hypnobirthing, and I feel that's like a lot of our traditions that we use within our culture, because it's about doing the right positions that help you, because you want gravity. You don't, laying on a bed is not going to help you. You need to move about, bounce on a ball. Go on. I know what you're going to say.
Why did they make you lay on your back?
I laid on my back. It was horrible.
Like, why are you on a hospital bed? I don't get it.
Do you know, I couldn't tell you why, because I've not experienced that myself. Like when I was in the pool, they had a little bench for the first one. The second one was on the sofa, but gravity had already hit, like she came. So I don't know. I think that's just an old technique. But I would never recommend that to somebody. Because the thing is, you can feel so irritated when you're having contractions. You can switch.
I switched so much.
So you need to do what feels comfortable for you. So some people might take off their clothes because they're hot. I've experienced that, where I'm hot, I'm overwhelmed, I'm irritated and stuff like that. But I'm not in the presence of like no men or anything. But you've got to do what feels comfortable with you and your body, because sometimes you may try something and it doesn't work because you're just irritated.
And as well, they don't tell you that you can do that. I feel like sometimes, like, you know, with all the shows that we see women giving birth, they're all laid on the bed with their legs out like that. And you think that this is how people give birth. So you don't, even if you wanted to lay down on all fours and rock back and forth, you might not feel like you can. You know?
Yeah, that's why.
And especially when they got you hooked up to the machines, like, you know, with the baby.
You feel like you can't move.
You literally feel stuck.
If you're on the monitor, then you're restricted. If you're on the CTG machine, you're kind of restricted.
Yeah.
Other than that, you can move about. So for me, when I have clients, they get booklets from me. So they'll get like, if they feel they may suffer from postnatal depression, there's a booklet and a journal that I've created for the women. There's also a newborn care book that I will give to the women. And there's also like a label one. So we would go through the different positions that you could do with your partner, if the person has a partner, or that I can support them with, and just direct them in that. So that's what I would support women with, giving them alternatives with different positions, because you want gravity. You want the baby to come to the birth canal.
Yeah.
So you want to do positions that's going to help you. Like you might want to go on all fours, rock. You might want to rest over, you know, like the bed head.
Yeah.
The bed, yeah.
And gravity, that helped me on my last pregnancy, and she came. So I think it's just about going through different techniques and procedures to help the woman. And for me, I'm an observer, so I would observe the woman and then give her techniques based on that. She might want her back rubbed and different things. She might want water. So for women, I would make sure I have straws if they don't have a straw. So, you know, like you get dehydrated, you can just sip your water. You don't want to hold it.
No.
You're irritated. The same thing with the gas and air, what I've suggested to, if the partners are there, hold the gas and air for her. And I warn them, she's going to get irritated. Don't take it personal, because she can't be bothered to hold it. So when she goes and grabs you, you just know when that contraction starts breathing in, you'll see her behavior. Give her the gas and hold it. When it slows down and she stops, she calms down, take it away. Then keep doing that. That's why you're there, to support.
Literally.
That
Not
was
to
my mum's
watch.
job.
And it's so simple, but I think people need help and support with knowing what to do, because they don't know what to do, because that would help. The woman doesn't want to think about holding the gas and air.
It's true.
She doesn't want to think about
Trust
that.
me.
Yeah.
Trust
be
me.
These are
thoughtful.
your worries. The pain that you're feeling every 2 to 3 minutes.
I don't even remember taking a sip of water or doing anything. I was so gone.
Yeah.
And that's why you need
Half
someone
dead.
there. So like, I will be there. If you needed fruit, here, I'll be putting it in your mouth. You need some
I
water,
was
there
so
will be a straw
hungry.
for you to sip. So you don't have to use your hands. I've got to be there, hand and foot, whatever you want. If you want lights, well, you can't have candles, but you can get the LED ones. You might want the mood to be lower. So that's why you go for a birth plan with somebody.
I really wish I had
Me too.
a low risk pregnancy, because I would have went for the water bath.
Yeah.
100%.
I feel like all these women need to show this video to your husbands.
100%.
If you at least can't be that support partner and that support system, hire one.
Yeah. I agree. You know, when people talk about what's that push gift?
Yeah,
Give the
push
gift.
present.
But pay for a doula.
No, seriously.
Oh, yeah.
A push
swear to
present.
God.
Oh my
Even
God.
if it's for a week, just to help her out.
I really think it's the least you can do.
Yeah.
Genuinely.
Because, you know, in our culture, we have the 40 days
I know.
period. So a lot of Somali women, they go back to their mum's house.
Yes.
And they stay there for 40 days. And then on the 40th day, they actually throw a party.
Yes.
Like a small little party. She gets her henna done. She gets her hair done.
Yeah.
And then, like, she kind of goes back home to her husband looking all dolled up.
And that's when the
But-
accidental pregnancies
Yes.
happen.
That's when the second baby or third baby or fourth baby.
11
However,
months difference.
Sometimes I side-eye it a little bit.
Why?
I don't side-eye the whole stay with your mum. I think that's beautiful.
Yeah.
What I side-eye is the fact that he missed out on all the...
Care.
Like, I want you to see
Yeah.
me in the state of, like, sleep deprivation. I want you to see me stressed. I want you to be there during the sleepless nights. I don't want you to think, oh, she just came back looking all beautiful. This seemed easy for her. She had a good time at her mum's.
Yeah.
No, I want you to be there
Yes.
every night. I want you to see, like, exactly what I'm going through.
Yeah.
I just feel like maybe it's an easy way out for men. I don't know.
I don't think so. I think that's more of a topic of conversation. And I think it's about communicating that, like, to say, like, babe, whatever you call your husband or your partner, like, I'm feeling a bit sleep deprived. Do we ever ask the men, how are you coping since we've had the baby?
It's true.
How are you finding it? Because I was like that on our third daughter. I thought I was just the one sleep deprived. Everyone in the house is. Our 2 daughters, he's sleep deprived, so it's not just me, so that's quite selfish. So you need to also consider the other people in the house. You may think it's just you, but if we speak and communicate, you'll find out no, all of us kind of feel that way. So it's like, okay, what solution can we come up with? Because remember, if your husband's working and stuff, he just wants to come home and sleep.
It's true.
So it's about having that kind of plan and as a team, how it can work to make things easier for you as a family. And what may work for you is not going to work for you.
You know, that's the disconnect where
Yes.
people then end up really miscommunicating,
Yes.
and then it just goes downhill from there and it ends in divorce. I feel like a lot of the times that very, very vulnerable window of after a woman has just given birth to adjusting to this new life,
Yes.
especially going from just husband and wife to then having a child the
Yes.
first time. I feel like when people have kids that like first, second, third, it gets easier because you've
Yes.
already gone through that one window
Yes.
and you know what to expect and what's coming. But as newlyweds and as new parents, that first window is so important, I feel like, because if there's a disconnect there, then the resentment that can build up from
Yes.
that disconnect is, I feel like, almost sometimes you can't get over that resentment, and it's very difficult. So that's why I'm saying show this to your husbands as well, because this could be make or break for your family.
Relationship. Definitely.
Yeah.
And that's why I feel when you're in a relationship, you need to communicate.
Yeah.
Communicate needs to be the foundation of your relationship.
Facts.
Even when you might tell your husband something he doesn't want to hear, whatever, that's your teammate. That's the person you picked. So you need to communicate how you're feeling. And then once you let that out, it may not be as bad as you think. And then you need to come up with solutions to make it work. You need to put that effort in to make it work. And that's why I think that's where things lead into the postnatal depression on both sides of things. Because you're thinking you're going through something, he's going through something but not vocalize it to you. You're having resentment towards him.
Yeah.
He don't even know what he's done to you because you haven't spoken to him about it. You need to say, do you know what? I'm tired. I'm struggling. I'm always breastfeeding this baby. And sometimes men are logical. Women are emotional.
Yeah.
So my partner always had the greatest solutions. It's just for me to listen.
Okay.
Because he would carry her and she would be silent. Women are more emotional. So sometimes maybe you should go and, not maybe, you should go and speak to your partner and see what his view is.
Yeah.
As that masculine energy instead of the feminine emotional energy, because you've gone through a lot of trauma and you've got to understand that your hormones are all over the place and they need balancing out. So you need to communicate with your partner. You have to.
Yeah.
You have to remember who he was before you had a baby. That was your partner, your best friend, whatever. You need to keep it that way by
Facts.
communicating with him. Or you need to say, do you know what? I'm speaking to you from a friend, not from being my husband. So sometimes you need to have those dynamics. Or do you know what? I just need to vent and I need you to listen. I don't want your solution.
Yes.
Or I need to vent and can you please give me your solution at the end?
Okay.
And it's for us as women to listen to your partners because
real.
you've chosen him. So why choose him and don't listen to him?
That's true. No, sometimes
Why choose not to listen to your blessing that you chose?
when I'm in a mood,
For real.
I'm not trying to listen.
And that's what.
When I'm in a mood, I'm just like, no, I'm right. Period. Because I'm the
Wrong
mum,
and strong.
Right?
And the thing is, sometimes you think does that get you what you want?
No,
No, it doesn't. It just
It
makes
really
me
doesn't.
feel worse.
It's
Right.
true. It doesn't at all.
And that's where you need to adapt and adjust. And it's a lot.
It is a lot. Especially when you're like a first time mum.
It's a lot.
Already, you're a first time wife.
Yes.
You just
going
adjusted
for
to
everything
being a
first.
first time wife. And now you're adjusting to be a first time mum. And you're also adjusting to both of you being first time parents together.
Yes.
Like, it's just
And
so
that's where
many
you need
changes.
to be considerate. You're both going through the same thing
Yeah.
the first time. So you're both experiencing it, not just you.
It's true.
And that's
It's
where
true.
there needs to be compromise and other things. Like there's one book that I've read. What is it? The Righteous, like Behaviors of a Righteous Wife.
Oh, yeah.
And those are things that you need to take on board. Like sometimes you need a reminder of your behavior and your attitude and how it can affect your relationship.
That's very true.
And you need to, as women as well, we've got to take accountability for what goes on in our life and make decisions, because when you don't take accountability for your behavior, nothing changes, because a lot of the time you end up blaming someone else, where you need to kind of look at yourself
Facts.
thinking, do you know what? I should ask him, how do you think I should manage this? I'm struggling to get the baby to sleep. What do you think I should do? Or blah, blah, blah. That's your teammate. You need to ask him what's going on and get his solutions to help you.
That is very
That's
true.
why he's there.
I completely agree with that. I
100%.
completely agree with that.
Remember why he's there, and think some people don't have that.
That's very true. That is very
And you're
true.
blessed with it, and then you just ignore it. Because of
I'm
our
inclined to
hormones.
agree with you only because I've healed.
Yes.
That's the only reason why I'm inclined to agree with you. A year ago, I would have told you that what you just said is bullshit.
I completely
Right?
understand.
I'm literally only inclined to agree with you because I have healed.
Yes.
And me and my ex-husband are in a good space right now.
Yes.
That's the only reason why I'm inclined to
No.
agree with you.
No,
But
alhamdulillah, you guys are good though now.
alhamdulillah, we're in a
Yes.
very good space right now.
And that's
Yeah.
the best place to be.
And it's, do you know, sometimes I feel like parents, like, okay, yeah, make it work within the two of you and keep it as a family,
Yes.
dynamic, nuclear family, etc. But I also wholeheartedly believe that sometimes children are happier in separate homes where both parents are happy and both parents can pour 100% into this kid. Because like now, my daughter, she knows that when she goes over there, she's going to be treated like a princess and a queen.
Yes.
And then she knows that when she's with me, yes, I get angry because I'm a mum and because I get overwhelmed quickly.
Yes.
But also because I'm trying to discipline you at the same time
Yes.
as being your lovely, wonderful, caring mother, right? So it's a lot for me, and I'm also the one who's with her most of the time.
Yes.
So she does know that she has 2 homes that she's very much cared for in.
Yes.
And furthermore, 3, including her grandma. So she has 3 spaces that she can go to where she is the main focus.
Yes.
She is the one that everyone is in love with. She is the person that they pour all of their energy and all of their heart into. So I personally feel like I would rather she had separate spaces like that where everybody is happy,
Healthy
rather
environment.
than, 1
understand.
or 2 spaces where maybe things are not like, what's the word? There's a word. What's the word? Recently I've been losing my words. I need to start taking my vitamins more.
Toxic?
No, I wouldn't say toxic. I would just say like where it's just not matching, like not connecting, where things in that household are maybe not flowing the way that they should, and there's not that, care and consideration towards the parents.
Yes.
Do you know what I mean? Where both parents are still trying to focus on the kid,
Yes.
except both parents are unfulfilled and not happy. I really do wholeheartedly believe that she is better off now in this situation that we're in. And we've made the best out of this bad situation.
Yes.
And I don't even want to call it a bad situation. I don't feel like it's a bad situation. I feel like this is just what works for us.
Part of the growth.
Yeah.
Growth system. I just feel that relationships are hard either way.
They're so hard.
Whether it's with your mum, your dad, your
real.
sisters, the partner you choose. I think it's just choosing a person to go through your trials and tribulations with, even when it's bad.
Yeah,
That's a hard thing for people to do.
it is.
To still, it's like you wouldn't turn your back on your kids if things went bad,
No.
but we'll be quick to do it to our partners who have chosen to be our family. It can become very overwhelming.
For real.
Very overwhelming. So it's an important decision, I think, when you go into a relationship. Then when you choose to have a child, it's a great responsibility. It's a great responsibility, and it can become hard, very hard.
Yeah. See, with me, I got pregnant very quickly into the marriage.
Yes.
So we were married for like about, I'd say we got married. I had 1 period, and then I was pregnant by the 2nd period.
Yes.
So it was literally like
Damn.
in a month,
Very
like
fertile.
literally in a month. They say the most fertile people in the world are Jamaicans, Somalis, and Nigerians.
Please don't tell
The 3 most fertile people in the
Probably
world.
have 10 kids by now.
Somalis
Say-
definitely.
Literally.
Somalis definitely.
In the hospital, they're like, why are all these people coming to the hospital? Because we come from a big family.
For real. So yeah, it was a month. I feel like we didn't even have a chance to get the dynamics of husband and wife
Yes.
before we introduced a pregnancy
Yeah.
and a child. So now looking back and taking accountability
Yes.
from where I went wrong.
Yes.
And as well, because it was my first marriage, I didn't, how we just had the conversation about it's not just you going through it.
Yeah.
I genuinely thought I was the only one going through it. Like I was in my bubble, like I'm experiencing this. This is
Yes.
about me. Why are you inputting yourself into this? This is all me, right?
Yes.
So now looking back, I'm like, right, okay, you should have asked him how he was feeling. Right, okay, it wasn't just you. you weren't the only person that was a first-time parent.
Exactly.
You know, you weren't the only person that was going through this.
And
you weren't the only person that was like, you know, married, husband and wife. Like, there's two of you, right?
And these are questions even, you know, before you're getting married. Those things need to be on the list.
Yeah,
Like,
definitely.
how, if you're upset, how do you manage that?
Yeah.
What's your outlet? How are you around children? How do you think you would cope if I was sleep deprived, or we had a child and they didn't sleep?
Yep.
It's all these questions that we just overlook that is important. So then you kind of know how someone may deal with things. Do you understand? It's just like asking someone, how many kids do you want? If I had a child, would you want me to work? Would you want me to stay at home? Because if you don't speak about those things, that's where conflict comes in.
Yes.
Because you haven't raised these questions. But you're going to go through these things, so you need to ask the questions beforehand.
For real.
Do you understand what I mean? So that those dynamics need to be put into people, I think, before they get married or even have children and they're not married. Because to me, you're making a commitment to bring forth a human being. So these conversations need to happen. Like, how would you cope? If a child was screaming, how do you cope? Because it's just like I said to a lady that I was helping, she had mental health issues. And I said to her, there's times where you're going to be alone, where I may not be here with you, your mum may not be here with you. How would you cope? And because I said to her, those moments are going to happen.
Yeah.
So how are you going to cope? You need to think about, what are you going to do? Like, I would suggest to the woman, you go out for a walk. You go out for a walk and a stroll, because when you're in your four walls and you're in your head, stories can fester into things that don't exist.
Yeah.
Things that stay in your head is not good. You need to get them out and vocalize them, and it will help you. And you need to do things to help you.
Yeah.
And I just think those are like good tips that you just need to think about, when considering a child. Because being in a relationship is one dynamic, then having a child
Completely
that
different.
will demand your attention. Because remember, your attention, especially if you're breastfeeding, your attention is not going to be on your husband. Some women, I've read on like some of the Facebook groups I'm on, their desire for intimacy goes out the window.
Yeah.
Your body may change. Is your husband still going to be attracted to you? There's so many things to consider. Are you still looking after yourself like when you met him before? Or have you just forgotten about yourself? Because it's easy to happen. So it's all of those things that I would help all of my patients with. Like, self-care is a big thing that I tell people to look after their self. Like, when you're waking up in the morning, if the baby's sleeping, make sure you have a shower every day when you wake up in the morning. If whether you're religious or not, go and pray or meditate.
Yeah.
If you can get fresh air so you're not stuck in the four walls. Make sure you get dressed. Don't change into pajamas. Do your hair. If you wear makeup, do makeup to make yourself feel better. Those are things that I would say as self-care tips. Then later on, as the baby gets older, I would say like doing things like swimming.
Yeah.
If you can go to a gym where they look after the baby, you've got someone to look after the baby. Do things like that to help yourself and your mental health. Definitely, I would say that.
We really forget how important it is.
It is. It's very important.
It's so important.
What was your favourite thing to do for self-care, like after you had your babies?
What self-care did I do? Oh, my first daughter, I went gym.
Nice.
Gym.
Yeah,
Nice.
I went gym nearly every day.
Nice.
Crazy.
I went gym nearly, like, I think when she was about 2-3 months.
Yeah.
That's when I started going to a gym.
Nice.
And I started going to a gym. That helped me. Did I go swimming? I might have gone swimming.
Yeah.
And that was it. And I would always make sure I shower, dress, do my hair, things like that. Because if you don't, I think my third one, I maybe didn't do that so much.
Yeah.
So things that I would do to help myself is I would run myself a nice bath, and then I would put her in her baby chair and make her come and sit next to me. Because if I left her, then she started to cry. My relaxing time is gone.
Oh. Yeah.
Whereas if they're next to you and they have a soother, I call it a soother, I don't call it a dummy.
Yeah.
You can give them the soother or a toy, or you play
Yeah.
the relaxing music on, like, just do things to help you as much as you can transition.
Man, I completely gave up on myself, man.
Me
First
as
time
well.
around.
It happens.
I didn't do anything.
I didn't do a single thing as well.
Didn't even leave the house
Same.
much.
This is a big thing. I think that happens quite a lot with people not leaving the house. Obviously we have our traditional time where we stay in the house. We don't really go out, because I was like that, I think, for 4 to 6 weeks each time I've had my children. But after that, it's like you can stay in your own bubble, and you need to go out.
Yeah.
Like, I even see like I've noticed a lot of like white middle class people, they will go to the baby groups, they will meet friends for coffee.
Exactly.
Yes.
And I think that's really important, and I think that's something we need to start bringing in to us, because before we used to run a sisters group in Brixton, like a 1 o'clock club where the sisters used to get together with their babies and stuff, and I feel those things are very important, and we need to start doing those things, going for walks in the park, meeting with other friends, meeting with other mums who have maybe babies the same age as you, just for yourself. Like that could be your respite, just going out to get some fresh air. You might just go for a walk to the shop, but things like that is important. You need to make sure that if you have a child, you put these things into your routine to help you. So because sleep deprivation is one of the things. Remember, you've gone through the changes, and then remember, once you've got all the bleeding, and sometimes remember people have excessive bleeding, so remember that's iron. So you need to make sure that you're eating things that replace the iron, like having beetroot juice, having greens and things like that to help you, because your body's not getting the nutrients, so sometimes you can't be bothered. It's easier to just go back to bed.
Oh man,
how do you feel about a vitamin drip?
I won't get that.
No.
A lot of people are against that.
To me,
Really?
natural is best. Like for me, like my iron's quite low, like with deficiencies and stuff like that. So I try to make sure I introduce beetroot, and obviously having your monthlies every month, you're losing excessive blood. So you need to make sure you're eating the right foods, like having red raspberry tea and things like that, just to help your body recuperate from what is lost. Because if you remember, you're doing that every month and you're not replenishing your body back.
That's true.
No wonder why you're tired and you can't bother to do anything.
That's very true. I don't know why. 100%. I don't know why people are against the vitamin drips. I've been wanting to try it for a minute now.
No, I've been seeing it. Like there's all these little random stalls that pop up.
Yeah.
But like, how can you trust this random woman standing in the middle of Westfield, charging $150 for a?
No, go and
Do you know what she's putting inside of you, fam?
Yeah, go and get your CMOS and go in the sun.
Yo,
that's your vitamin D.
Listen,
I have CMOS all the time.
Listen, leave the CMOS
morning.
out if you're not married, bro.
Oh.
Leave the CMOS out if you don't have a husband. Don't leave the CMOS out. Don't do that to yourself.
Give you super strength.
Don't do that to yourself, because I had to jump off it. Like I was. Listen. Let's not even get onto that. I'll just tell people my business and that.
CMOS, no, you need those. You need those things. Bro. You need to have, as a woman, you need to have your CMOS, your beetroot juice, put your apples, your ginger, whatever. Do everything you can to help with those things, because you're gonna go through it.
Yeah, man.
This is the thing. You can't be blind to it. You're going to go through these stages of fatigue.
Yeah.
My youngest is 5.
Wow.
I still am fatigued.
Yeah.
It takes years to get rid of that.
And I've spoken to other mothers where they feel like their child may be like 1, 2. They're just getting to feel like themselves. Then remember, you got to start doing the nursery run.
Oh my God.
And the school pickup. So there's a lot. Then you got to try and work. Yeah, I am on countdown for the school run to end. I cannot wait.
I hate school run.
So I don't like school run neither. Yeah. Like it. And the thing is, if you think of other countries, remember the parents don't do school run. I didn't have a school run. I can't remember the last time my mum brought me to school. Yeah. Do you understand what I mean? A lot of us, we went to school with our friends, our cousins.
Yeah.
No one checked on you. Remember, we didn't have mobile phones.
No, it's true.
Things are different.
I used to go to school by myself.
So did I.
When I hit primary school.
From year 4, I went to school by myself. I swear to God.
And then I'll meet up with my cousins along the way.
Yeah, along the way you'd meet up with the other people and their parents, or some of them.
Because your mum has to go to work.
Yeah, my mum used to go to work. From year 4, I used to go to school by myself.
In our household.
And how old is that? Like 8?
In our household, I think from up until you're in year 6, someone takes you to school, like either my mum or my dad. And then as soon as you hit year 7, you're getting on the bus to secondary school. That's always been the rule
You're
in my
on
house.
your own.
Yeah, because my little brother, when he was going to primary school, I was going to college.
Okay.
So me and my sister would take turns. Tomorrow you're doing it.
Rotating. But think of people who don't have that, because I said you need to give yourself a reality check when you have a child.
Right. Mm-hmm.
So you got to think, okay, so if your child starts nursery at like 3 or childminding, so from 3 up until they're 11, so year 6.
Yeah.
You're doing school run.
Yeah.
So you're dropping them off at 8:30 or 9 o'clock when there's traffic, whether you're taking bus or driving when everyone's driving, unless you've got a walk like 5 minutes, then you're okay. Mm-hmm. So you got to commit to that for 5 days a week. Yeah.
I'm telling you, man.
For a number of years.
Yeah.
Do you know
Yeah.
how sad that is?
It's a lot.
Sometimes I like the way Americans do things.
The school bus.
The school bus. I would pay for the school bus.
I would
Oh
so
my
pay for the school
God.
bus.
I
Oh
would
my
pay
God.
for.
Just
I would
pull it
pay
up.
for the school
Oh my!
bus.
I would so
I
pay
would-
for the school
why
bus.
can't
In the
the
next
UK do
lifetime,
this?
in the next lifetime, when I have children,
Yeah.
I will make sure they're in that kind of setting, or I will homeschool my children and pay for I will pay for an au pair
Uh-huh.
for that support. If I don't have a family member, I will pay for an
100%.
au pair
100%.
definitely to help to support with that transition. Because the other day, I think I done school run the other day when I picked them up, and I was like, all the people like the rush, I was like, I'm not built for this.
I know.
I was like, I feel so awkward. I'm not built for this. All the parents, I'm just not built for it. I can't wait until it's over.
You know, I was talking to my
Yeah.
daughter's dad the other day, and the dynamic that we've got going on right now is that because I work 4 days a week,
Yes.
I usually have Friday off. So Fridays he picks her up.
Yeah.
So what we've done is, because she goes to nursery, we've just skipped Friday
Yes.
every week, and he'll just come in the morning, pick her up, and I have the whole Friday to myself. So that's what we've been doing so far.
It's good.
But she's starting reception in September.
Okay.
And we
Big boy
won't be
school.
able to skip Fridays anymore. So I was having this conversation with him. I was like, what are we going to do? You're
Yeah,
going to have to
good.
come here at 3 o'clock. And then you're going to have to take her from 3 o'clock. I can't even skip Fridays. Like, literally still have to do it every single day. The school run is a nightmare.
And that's something you need to consider when you have children.
It's such a nightmare, to the point where I've like signed her up to schools near my mum's house.
Yeah.
She's literally at the schools. I've applied for the radius around my mum's house, walking distance
Yes.
around my mum's house, because there's no way in hell you're gonna catch me going from my house all the way to school, and then if I'm late on the way back,
Yep.
nobody's gonna be able to
Nobody
pick her up.
That's
That's not
another
gonna be me. No.
And if the school doesn't do after school, there's so much factors you have to think about
No, man.
that you don't. And then getting to work, is your work job going to be flexible once you've dropped a child to school?
And pick them
Can
up.
you get to work
Yeah.
in time? Or some parents, when they're working, remember they've got to send their child to breakfast club
Yes.
and after school club. So to
That's so
me,
exhausting.
that's a lot, and it's exhausting for the child.
I went
Like,
through that life, you know, because
my
I'm an only
5-year-old
child.
is like, Mum, why do I have to go to school every day? She said, it's too much.
Oh.
It's too much. It can be overwhelming.
Yeah.
You know, I went through that life because I was an only child.
Yes.
And my mum, she used to work. So, okay, to be fair, she worked in the same building as me.
Yeah.
But she would take me to after school club every day. So every day I would go in for the morning for breakfast club, and then I would stay there all day at school, and then I would be at after school club from 3 o'clock until 5:30.
Which is a long day.
That's
a
like
long-ass day.
that's imagine if I wake up at 7, that's nearly 12 hours.
It's a long.
Like that's nearly 12 hours that I've been awake
It's
and
like you've
doing
done a
stuff.
shift at school.
That's a whole shift. That is a whole. That's nearly a 12-hour shift.
Yeah.
That is a whole shift at school, and I did that every day. Wow, it's mad.
It's a lot to
It's
consider.
mad.
Yeah, I
It's
think I
mad.
always think about like when me and my sister were in primary school, and I've got a brother who's 4 years younger than us,
Yeah.
so 3 of us would always be together.
Together, so that's good.
But like when we were much younger, I remember my mum's best friend sometimes would be like, "You're coming to my house,"
yes.
and that's how I knew like, oh, mum's at placement, because
Yeah.
my mum was literally studying to be a nurse.
Okay.
My dad had shifts as well, and I used to think like
The dynamics of
back
it working.
then you don't really notice the struggles.
Yeah.
But now I'm just like, my mom's probably calling her friends saying, "Can you pick up the kids?" And then I'll come to your house later and pick
Come
them up.
home and
Like, do
cook.
you get
Uh-huh.
it?
Do the laundry.
Uh-huh.
And remember we're cooking meals from scratch. Please take that into consideration. So that's where you need
Yeah.
to, like, a friend I was talking to the other day, she will prep meals for 2 days.
Mm-hmm.
So it's doing things like that just to help you,
Yeah.
like having a food processor or whatever,
Yeah.
chopping up everything in advance, putting things in it, marinating it, putting it, like I was saying, doing for Ramadan. You
Yes.
put everything in the freezer, you
Yeah.
take it out, defrost it. There you go.
Cook. All you need is. Oh, you know what my mum does? My mum chops up loads of onions, and then she'll put them in little ice cubes,
Yeah.
or she'll put them in little like small containers.
Yes.
And then that's it. When it's time to cook, pop one out, stick it in, wait for it to quickly defrost. Stick the meat in that she's marinated like last week. Like it's so simple, but you need to prep in advance for that.
And the thing is, it's good to prep because it makes things easier
Yeah.
for you. Because you just need to be realistic. Like, okay, I've got work, I've got to pick up the baby, I've
Yeah.
got to do this, that, and the other. You need to have like a schedule. Really, when you
100%.
think about it, you need to have a schedule to make things flow and to make it easier.
That's so hard for people with neurodivergency like me. Like I struggle with, like we have a routine with my kid. So we've already established this routine,
Yes.
and I struggle to stick to the routine.
Okay.
Not because of my ADHD, but just because I'm very flexible with change.
Okay.
My mum is not flexible with change. Like, she sleeps at 7 o'clock every day. She has to sleep at 7 o'clock.
Okay.
Me, I'm like, oh, okay, if it's 7:45, okay, sorry, innit? It's
Yeah.
45 minutes late.
I'm
Not that deep.
flexible like
Yeah,
that
I'm
too.
flexible like that. So then I find myself never sticking to routines, because I'm like, oh, if it goes a little bit haywire, if it goes a little bit off for a couple of days, that's all right.
Yeah.
Then the whole schedule's messed up.
Yeah, when
So,
the schedule gets messed up, I stress. Like, when I pick my children up from school and they try to go on gadgets, I'm like, what are you doing? One needs to go in the shower, one needs to go in the bath.
Yeah.
Sort yourself out. I eat. So during the day, I will cook during the day so that I can spend time with them, or they can do what they want. So I'm not stressed out, because I know if I don't cook while they're at school, once I pick them up, all three of them are talking to me at one time.
Oh, yeah.
And I've got to pay attention to all three of them. And I'm like, oh my God. So you have two, and then the older one comes from secondary school. And then she vents. And then I'm like, oh my gosh. Then before you know it, it's bedtime.
Yeah.
So you need to have some kind of structure, because when they don't go in the shower, I'm like, no. You can do what you want. Once you've gone in the shower, the bath, you can do what you want after that time.
Yeah.
If you go on your gadgets, but 6 o'clock, you're coming off of it.
Yeah.
Like, there needs to be some type of order. You go in bed at this time, TV's going off at this time, relaxing music or meditation music, because the children need a certain amount of sleep. And I feel we actually need a routine as adults.
Of course.
Because I find that's what I need, because it will help me. Because if I'm going bed and sometimes I can't sleep and I finish work late, and like, I will go on my phone just before, but I've got to wake up at like 5:36 in the morning. Like, what?
You blink and you're doom scrolling, and you've now been on there for an hour and a half.
Hate that.
TikTok is a demon. I literally I've been staying away from it for the last week. TikTok is a demon.
You've got to have a plan. Like, the other day, like when I finished work late, I came in, had my shower. This is the first time I didn't go on my phone, because I had words with myself the day before about making a contract with myself. So I said, let me go sleep. I had a shower, got dressed before I woke them up, prayed. No, I got my first daughter up, middle daughter up, and then I prayed. So I have a routine of how I wake them up.
Oh, wow.
Yeah, one after the other, different times. So yeah, I prayed, and then how it flowed well.
Nice.
And those are things. That's why I think, in some aspects, yes, you be flexible, but in some things, I think you need to have a system or schedule in place just to help you.
I agree. I need to start implementing that and actually sticking to it.
And if you don't stick to it, don't feel guilty.
Yeah.
Just go back to it, because no point in holding on to guilt. Say, okay, today didn't flow as well. Or, like, if you don't go, say if I divert. So if I pick them up from school and I go to the shop, it diverts them from going in the shower, from going on the gadgets for a little bit. If I haven't cooked during the day, then they end up going to sleep a lot later. So that can push. If it's a Friday, it's okay. But if it's during the week, it just puts a spanner in
the works.
And it just doesn't help. And then they don't sleep well, they don't settle. Then in the morning, it's like, oh, Mum, I don't want to go to school. And then you've got all three saying, I don't want to go to school. And I'm like, oh my goodness, it's one of those days.
Sorry, go on, Sophia.
You go on.
I was going to ask a quick question. I was going to say, do you do like mental health days? Like, if your kids wake up one day and they're like, no, I genuinely don't feel up for school today, would you allow them to skip that day?
Yes.
Yeah?
Yes. The only impact of that is, obviously, you have school attendance people.
Yes.
Now, if your children are not feeling well, to me as a mother, my duty is to keep my children at home and nurture them till they feel better.
100%.
They don't feel like going.
100%.
And I feel, as a parent, me and my partner have the right to keep them at home.
Yeah.
If they want to stay at home, because they're not feeling up to it. If my daughter's feeling overwhelmed, no, I don't want to go into school, I think you should be allowed that, as they're your children. But sometimes I feel like they belong to the school or the government.
100%.
Yeah.
Because if they're not in school for a certain amount of days and stuff like that, because my children have picked up so much bugs in school.
Oh, yeah.
And I said to my daughter,
God.
I told you, don't eat the school food. I will gladly make packed lunch every morning, and that's what I will do. I'll gladly cook and make things for them, packed lunch. Like, I bought the thermos so they can have hot stuff, because they don't always make cold stuff. And I bought like mini patties and stuff like that so they can have proper food when they go to school, because they picked up a lot of bugs. You can't send your child to school if they got bugs.
No, you can't.
So yeah, I would definitely let my children have mental health days and stay at home if they're feeling overwhelmed. I'm a supportive parent. Yeah, I wouldn't want to send my children to school and they're overwhelmed. I don't like doing that. If my daughters feel overwhelmed, or the youngest one is like having a fit, like adamant she doesn't want to go to school, I don't like school, I hate school, I feel some big sense of guilt if I send her to school.
Yeah.
But you know, now if you work and you're a single parent, these are where the questions come into play. How would you deal with that type of situation? Because now for me, if I worked, well, I do work, but if my little one was adamant that she did not want to go to school, but I had work that day, what am I going to do?
I can't answer you. I'm on camera. My children are important to me.
I hear it. Calling sick. I hear it.
My children
what I'm gonna
are
have to do,
very important.
They
I
are,
love my children. It's more than love for my children. So I try to make sure that I'm as supportive as possible.
Beautiful.
I'm harsh with them sometimes, but I try to make sure I'm nurturing and give them the love and support they need. But there's 3 of them, so it's a lot. And they got 5-year gaps.
Each of them, 5, 5, 5.
Wow.
Very structured and very...
No, it ain't structured. If it was structured, I would have had one after the other. The 3 of them, just one. Like how my grandma did it. My grandma had like 10 children, and they were like 1 to 2 years apart. I would have done things like that.
I can't do that.
But
I'd
the 5-year gap is
I would take the 5-year gap.
5-year gap. Was it a lot easier for you?
No, I think it was harder.
Do you think it was
Really?
harder?
I think it was harder. I think my first one, you know, when everybody's supportive, it's your first child, everyone's around.
Yeah.
But like now with our 3rd one, to me, it's just me, him, and our children because everyone's working. Grandparents are working.
Yeah.
So the support system is not there as much.
True.
Like my sister has them and stuff. So I have my nieces sometimes and things like that. That's why I feel you need that. You need that support system.
Yeah.
But yeah, 5 years is a big time.
One is
gap.
in year 11 and one is about to start year 7.
Yeah.
That's
So it's like 15, 10, 5.
16.
Oh, okay.
16, 10, 5, yeah. So it's a lot.
Oh,
Because
wow.
when I see people, they're like, I thought you was 20 something. I said no.
No, you actually look about.
But you look amazing. Though. You really
Thank
do.
you.
Amazing.
I'm like, no, pushing 40. I was like, come, I'm not 20 something. How am I going to have a 16-year-old?
Allahu Mubarak. Beautiful.
No,
And that's why I try to make sure that that's why I will promote like self-care to people because I've gone through it. So it's not like I'm just preaching to somebody.
Yeah.
I'm coming from experience, and it's coming from a place of love that I really care, and this is my purpose. So I could talk about it for days and stuff, and I will just offer support, like things that I've done wrong and where I've learned valuable lessons. I will try to help someone else and see if it helps them. And that's it. And if it doesn't work, like, because I do therapy and counselling session for young girls, and when I give them suggestions, I will say, we'll see if this works. If it doesn't work, we'll try something else. Yeah.
One more question before we start wrapping up.
Yeah.
Let's just say we have a newlywed watching this
Yes.
episode,
Yeah.
or we have a soon-to-be father watching.
Yes.
As a doula, talk to him as if like to help him understand how he can support his wife when she's in labour. What he needs to do when
I would even say before she's in labour, like while she's
pregnant, yeah.
Rubbing her feet, checking in with her to see how she feels and what she's going through.
Tell them. Tell them right there. Look them in the eye.
Just supporting her and seeing how she feels. Also vocaling how you feel, how you're both going to support each other. I would recommend to the husbands and partners to look up postnatal depression, baby blues, and even pregnancy psychosis, and look up the differences so that when you see any change in the behavior, you understand what it is and you can offer her the support and give her the numbers, or if she needs to talk to a therapist, a counsellor, give her the support she needs. Also, when she goes into labour, making sure you're asking her how she feels, holding her hand. As I said, holding the gas in there for her because she doesn't want to hold it. She'll get irritated. Don't take it personal. I would say you don't have to go to an antenatal class, or look on YouTube and just look up the transition of a woman going through being pregnant and going into labour, and then the postnatal part. And if you can afford it, I would say you hire a doula for her, as her support system for you and her. And then also you can hire a maternity nurse that can offer 24-hour care, or even minimum like 4-hour care, just to help her with cleaning, cooking if you have to go to work. So that's kind of what I would tell you to do.
Thank you so much,
You're
Karina.
welcome.
Thank you so
Thank
much
you,
for
thank you.
You're welcome.
for coming on. And I'm not gonna lie, you've just ticked another box for our guest list, because we were always saying we need a doula.
How many times did we say we need to do that?
Bruh.
And you know
So many times.
what's crazy is when and I think I put it in the form, I was just on Instagram and I saw you guys' page come up,
Yeah.
and for a while I took a break from Instagram.
Yeah.
And then I think the lady was talking about postnatal psychosis.
Yeah.
And I'd heard a similar situation of what a lady had done. So it was clicking to me, and then I said to my daughter, this will be a good platform for me to go and speak on, because the skills that I've gained throughout the years, it'd be good to give people the knowledge. And then I think I went on your stories and it said, oh, you're seeking doula. And I thought, why not put myself forward? And look, here we are
amazing.
today.
Yeah.
Wow.
That's beautiful.
Yeah, trust me, I saw your form and I said yes.
We literally
got
read
her.
your form and we were like,
Just what you needed. And
honestly,
just what I
we wanted.
needed. Yeah.
We wanted to speak to a
I
doula.
think you were the only one as well. I don't
And-
think we've had any other doulas.
And
Yeah.
that's what's
reaching out.
funny. I went to my friend's daughter's 21st birthday celebration, and when I spoke to a gentleman, like, he helps people with counselling and pregnancy counselling.
Yeah.
And when I told him I was a doula, he was like, "Oh my goodness, you're the second black doula I've met."
Mate.
Yeah.
Only the second.
So only the second.
What?
And he was like, "We need more of we need more of this.
Yeah.
We need more of this."
Literally what we were saying
Don't
earlier
worry,
on.
you know what? We're gonna plug your website,
Oh
everything.
my God, 100%.
Your
I'm
Instagram.
here to support.
Thank you
and
so
I have
much.
big plans for the Kente
No,
and Karing
100%.
Doulas.
We're gonna plug.
I won't let you know now, but watch this space.
Yeah,
You know,
inshallah.
we wish you the best,
No,
inshallah.
inshallah, like, may Allah
Allahumma
make your
barik.
business flourish.
I mean,
He is
and
Ameen.
there's a lot
already.
of blessing into it.
Ameen,
Alhamdulillah. Do you know what I
ameen.
mean?
I'm very thankful.
Yeah.
Ameen.
And I wish you the best,
Me too.
obviously,
Thank
going
you.
forward with your
Me too.
business.
Thank you.
I think you're great. You seem so
Yeah,
genuine and so
thank
pure.
you.
So I
and
really wish
if
you
I
the
have a
best.
child, another one, when I get married, I will be giving you a call.
Yes.
Definitely.
Because the thing is, you can also get virtual doulas if you're not close in
Oh,
proximity
nice.
to where
I
they
didn't
live.
know that, yeah.
Yeah, and I would always also another thing I would suggest to people: if you do choose a doula, make sure you do a consultation with them to see if you're a good fit
Okay.
and whether
Okay.
they can meet your expectations,
Okay.
and that there's a genuine connection. Because
yeah.
if there's not a connection, the person won't be able to support you with your
Yes.
needs. Yeah.
100%.
Thank you so much,
You're
Karina.
welcome.
Before we go, we just wanted to do a big shout out to Fozia Adam for sending us these books for our kids.
Yeah.
It's a story about Surah Al-Luqman, the lessons that Khalil learns. Jenna, how does she feel about this book?
She enjoyed the illustrations. The illustrations are
Yeah.
really cute.
They are really lovely.
I do think she's still a bit too young for it, but it's
Mhm.
okay. Honestly, I'll keep the book,
Same with Hannah.
and she'll be able to read it in years to come. But I enjoyed it at
So
a
did
big
I.
age
So did I.
because it taught me about humility,
And empathy.
and it kind of breaks down
Mhm.
Surah Luqman in
Which is
such a
important.
simple way. And sometimes even your big at your big age, you need to learn
You
the
need
deen a
reminders.
little bit.
Yeah, no, it's true.
Do you know what I
agree.
mean? So I really like, to all my sisters and brothers watching this, Ramadan is coming.
Mhm.
If you want to start bringing in Islamic book for your
Yeah.
for your kids, I want you to check out Little Scholars Club, and I'll
Yes.
make sure I write it on the screen, and support Fozia Aden because she has some really cool books.
She's amazing.
So we just want to say thank you, Fozia,
Thank you very
for sending
much.
this.
We appreciate you.
Yeah, 100%. We have to support our sisters, obviously.
And Ramadan Mubarak to everybody.
Yep.
We hope that you guys have a great fasting and iftar and tarawih. Yes?
Yeah,
We hope
yeah.
all your du'as are answered.
Shut up.
And
Wow.
we hope you give a lot of sadaqah. I hopefully will be joining a charity to raise money for cataract surgery in Somaliland. And hopefully I'll be doing the deployment, inshallah. So yeah, if you guys can, when the link is up, I will add it to the bio. Please donate. I'm trying to get 10k, inshallah.
So you're getting 10k.
I will get 10k, maybe hopefully
Inshallah.
more, inshallah.
But yeah, we've run out of time, guys. We hope you enjoyed this episode. Once again, thank you so much, Karina.
Thank you for having me.
Thank you, Karina.
Thank you. And guys, peace out.
Please
Happy
like,
Ramadan
subscribe, comment, everything.
Yeah, you know what to do.
You know what to do.
All right. Bye.